Hello everyone. Today I'll be showcasing a case of Intumescent cataract. Creation of a circular, well-defined, clear-cut capsulorhexis is always a difficult task in Intumescent cataract because there is a raised interlenticular pressure and sudden decompression can create Argentinian flag sign. I have showcased several Intumescent cataracts, how I dealt, how I created capsulorhexis, how I basically create a baby capsulorhexis to decompress the lenticular pressure in the past videos. This particular case was very challenging because there was very shallow anterior chamber space available and the lens was very tightly packed and swollen. Before initiating any puncture in the anterior capsule, always create your two side port incisions, remove any amount of any air present in the anterior chamber, go into clear corneal incision and fill the chamber tightly with viscoelastic, then make a nick in the anterior capsule exactly in the center of the anterior capsule. At this point you have to be very cautious. Do not decompress the anterior chamber suddenly. After a successful creation of a baby rhexis, now the time to decompress the raised lenticular pressure, because in this patient the pressure was very raised, so I created very small opening in the anterior capsule. So the decompression with the IA tip is not possible. Now time to massage the anterior capsule and the surface of anterior capsule. It breaks the loculi present in the lens matter and you can easily pump out the cortical matter and the fluid present in the capsule. You can see that the fluid is coming out very easily as you press. The blunt cannula, you can push some fluid also in the chamber and even some amount of fluid you can push inside the bag, but don't try to push more fluid because obviously there is a raised anti-lenticular pressure. The lenticular pressure is raised and if you fill it with the fluid, suddenly your baby rhexis can blow out. So patiently massage the surface of the lens and try to remove the cortical matter as much as the cortical matter you can take it out, because this will give a decent decompression of lenticular pressure. Now check it, fill the chamber with viscoelastic. Now you can see that anterior capsule is flatter and now it is in a concave shape. It means the pressure is not there in the lens, in the lenticular capsular bag area. Make a small nick in the anterior capsule and then try to extend the capsulorhexis to your desirable size. If you are not sure about the decompression, don't go much towards the periphery. Keep your limits in the center of the zone. But in this case, I created a decent size of capsulorhexis. As always, in majority of the cases, you'll find grade 3 cataract and easily you can do fragmentation. There is no need to perform any kind of hydro procedures in such cases. My technique of phaco-fragmentation is very simple. I just hold the nucleus with the tip and then I split the nucleus and I just keep the Sensky hook very close to the tip of the phaco, and then I split the nucleus in two halves, keeping the tip as a fulcrum. The technique is hold and split. It's very simple. In this technique, you really don't require any kind of fancy or designer kind of chopper. Simple blunt tip, small size of bend can do the whole complete. You can very easily complete and maneuvers your nuclear fragments with that, and it is possible to perform this technique with the Sensky. As you can see that I completed the phaco fragmentation and a loose cortical matter is present in the bag. ophthalmic surgery, you need a good visualization. So if you have the facility to enhance the glow, like in my case, I always try to perform capsulorhexis under increased reto-illumination, because that gives better visualization, and cortical cleanup I always do under reto-illumination. So in case if you catch the posterior capsule or any capsular area, you can very easily detect. So it's always same. The PC polishing is always, you can do better with the enhanced retroillumination. Now time for implantation. So here I used single piece hydrophobic implant, dialed it in the bag. So after implantation, I decided my capsulorhexis is looking slightly smaller. So again I filled the antechamber with viscoelastics. So after filling antechamber with viscoelastics, I created a small nick in the antecapsule to enlarge the capsulorhexis. It is always a good idea to enlarge the capsulorhexis, because if you are using any kind of premium lenses, as much as optics, if you expose, then the patient will get advantage of optics. And it is always a good idea to enlarge the capsulorhexis and make it slightly smaller than the size of optics, so that you will get the coverage, 360 coverage of capsular support around the optics. Sometimes smaller capsulorhexis opening can create a capsular phimosis after few years of surgery, especially in the younger age. Thanks for watching.